Hi, this is Cynthia with FMP 596, and this is my clinical encounter. The patient is AJ, age 58. She's an African American female. She's here at the clinic today alone. She's a good historian for her personal information. Her chief complaint: I have a runny nose, congestion, and non-productive cough, sore throat for 4 days. HPI, AJ is a 58-year-old African-American female who presents to the clinic today with complaint of runny nose, non-productive cough, and sore throat without associated fever or additional symptoms. The onset of the symptoms began 4 days ago, and it has persisted with intermittent episodes of coughing, nasal congestion, and throat irritation. There has been no improvement since the onset, and she notes worsening discomfort when she eats and she drinks. She has attempted to relieve her symptoms by using hot salt water to gargle, Listerine mouthwash, and she's been taking Tylenol 325 milligrams once a day to improve her overall symptoms. So far, it hasn't worked, and nothing really is improving her symptoms, and she says that nothing is making it worse. It's just a slow, insidious set of symptoms that she has experienced. Her past medical history: she does have hypertension. She went through menopause in 2017. Her medication is Losartan 50 milligrams, hydrochlorothiazide 50 milligrams. She takes both of these once a day, and she's taking a Tylenol 325 milligrams every 4 hours for her throat discomfort. The blood pressure medication, she's taking both of them once a day, and she admits that her blood pressure is well controlled with her medication. She does have an allergy to penicillin. She reports severe itching. She denies any other allergies, no food allergies, no environmental. She received all of her childhood vaccinations. She received the flu vaccine 1025, COVID vaccine 122, COVID booster 224. Her DTaP was 1 of 2020. Her family history consists of the mother and father. The mother has, she's 80 years old. She has a history of hypertension. The father is 85 years old, and he has a history of diabetes and hypertension. And there is no information on the parental or the maternal grandparents. The only thing that the patient says is that there was no chronic diseases in their family. Her social history: she is 64 years old, and she lives alone in a home. She denies being sexually active or any STIs. No pregnancy, no children. Her occupation: she's a retired auto worker. Education: high school. She graduated, no college. Diet, exercise: she report eating healthy fruits, mixed vegetables, assorted cheese, milk, bread, chicken, red meats once a week. She enjoys fast foods and junk foods, consumes 4 bottles of water a day, exercises twice a week. She does drink beer on the weekends with her friends. Her hobby is card playing. She denies any drugs, tobacco, or vaping. Sleep: she denies any problems with sleep, says she sleeps 8 hours. She does not attend church, but she says that she has a good relationship with family and friends. They are supportive of her. Her constitution: review of systems. Constitution: she denies fever, chills, night sweats, weight gain, weight loss. HENT: denies headaches, sinus pains, denies eyes, denies redness, itching, or eye pain, ears, denies ear pain or drainage, no hearing loss. Nose reports clear nasal drainage, productive cough. Throat reports sore throat, denies difficulty swallowing or choking. Mouth denies any mouth lesions or sores around the mouth. Cardio denies chest pains, palpitation, respiratory, denies shortness of breath or difficulty breathing. Patient reports non-productive cough, congestion, clear nasal drainage for 4 days. Her vital signs are 97.8, pulse is 82, respiration is 20, O2 saturation is 100% on room air. Her weight is 140, height is 5'6", she's 66 centimeters, and her BMI is 22.1. General. She's alert, communicates effectively, no anxiety, no distress, makes good eye contact, dressed appropriately, and groomed for this encounter. Her assessment, her head is normal cephalic, no trauma. Perla, EMO, intact, red reflex, present, sclera white, conjunctiva pink, no drainage or redness. Ears, there's no redness nor effusion. No, the tympanic membrane is pearly gray, bilateral. No redness or drainage in the ear, no soreness. Conal light is at 5 o'clock in the right, 7 o'clock in the left. No obstructions in the ear canals. Nasal septum is midline. Bilateral nasal turbines are slightly red, moist, patent, with clear drainage. Mouth mucous membranes are pink, moist. Uvula raises, midline, hard and soft palate. Pink, no lesions. Tonsils +2. No drainage. Pharynx is red. Trachea midline, no swollen lymph nodes. Cardio, S1, S2, no murmurs, regular rate rhythm, no displacement of PMI, no heaves, no thrills. Pulmonary, osculated bilateral. Lung sounds, no rhonchi, no wheezing. Respirations, non-labored, no intercostal retractions with breathing, no sternal tenderness or cervical tenderness with palpation and percussion. Respiratory excursion 2 to 3, has productive cough. Differential diagnosis, acute upper respiratory infection, ICD-10 code. Differential diagnosis, allergic rhinitis, peritonsillar abscess. Treatment plan is to treat her symptoms. We did a rapid strep test on her and it was negative. We recommended Flonase, 2 sprays each near every 12 hours for nasal drainage for 10 days. Guaifenesin, 400 milligrams every 12 hours is needed. For congestion for 5 days, Tylenol, 325 milligrams. One tap, excuse me, one tap for pain every 4 hours for 10 days is needed. Education, viral respiratory symptoms will resolve in 1 to 2 weeks. Drink plenty of water, fluids, avoid allergens that can aggravate your symptoms. Wash hand hygiene, wash hands frequently, use hand sanitizer, monitor your blood pressure daily for any changes. Keep a blood pressure log. Return to clinic in 2 weeks for follow-up and bring a blood pressure log. That's it. Thank you very much.